Hello everybody, and welcome to Best Top 10. Here you can find top 10 list about anything you might think of, so don't hesitate, and have a look to see what might interest you. Before we go any further, please subscribe to my channel, and press the notification button, so I can keep you up to date with my latest videos. Today, we are going to present the top 10 signs that you might have COVID-19. The disease caused by the new coronavirus. Number 10, fever. Most cases of COVID-19, the illness caused by the new coronavirus, are mild, but 20% of the patients have severe cases of disease or become critically ill. Fever is the most common and first of the symptoms. The normal body temperature is between 36 and 37 degrees Celsius. Varying from person to person. A temperature between 37.5 and 38.5 degrees Celsius may indicate a low-grade fever. A temperature over 38.5 degrees Celsius goes in the high-grade fever levels. When your body temperature increases, it is because your immune system identified a virus in the organism. You can say that by having fever, your body is trying to fight against a virus, or an infection. Since COVID-19 is a disease caused by a virus, you can expect that fever is the first symptom that you might have if the virus is in your body. Number 9. Cough, more specifically dry cough. A dry cough is a cough where no phlegm or mucus is produced, also known as non-productive cough. A dry cough is irritating, and usually associated with a thickly throat. Dry coughs are often caused by viral illnesses, such as colds and flu, but they can also be caused by allergies, or throat irritants. Coughs associated with the cold, or the flu, tend to last a week or two, most clearing up within about 3 weeks. A post-viral cough may persist for up to 8 weeks after a viral illness, while some coughs persist for longer, and are usually a sign of an underlying problem. In adults and children, a cough is described as acute, short-term, if you have been coughing for up to 2 weeks. In adults, a cough that lasts for more than 8 weeks is described as a chronic, ongoing, persistent cough. In children, a cough that lasts 2 to 4 weeks is called a prolonged acute cough. A cough that lasts more than 4 weeks is considered to be a chronic cough. A dry cough is often the result of a viral illness, such as a cold or influenza, the flu, or more specific for our case COVID-19, the disease caused by the coronavirus. So if you find yourself having this type of dry cough during this global pandemic, don't treat it light, because it might be a sign that you got infected with the coronavirus. Number 8, aches. Body aches are a common symptom of many conditions. The flu is one of the most well-known conditions that can cause body aches. Aches can also be caused by your everyday life, especially if you stand, walk, or exercise for long periods of time. You may just need rest, and some treatment at home to relieve your body aches. But some aches, especially ones that last a long time, may mean that you have an underlying condition. In these cases, you may need to see your doctor for a diagnosis. A cold and the flu are both viral infections that cause inflammation. These infections attack your body, and your immune system attempts to fight them off. Inflammation, especially in your throat, chest, and lungs, can be painful. The rest of your body might ache too, as your body works hard to fight the infection. Number 7. Sore throat. A sore throat is often a sign of a viral infection. Symptoms of a sore throat can vary depending on the cause. Signs and symptoms might include pain or a scratchy sensation in the throat, pain that worsens with swallowing or talking, difficulty swallowing, sore, swollen glands in your neck or jaw, swollen, red tonsils, white patches, or pus on your tonsils, a hoarse, or muffled voice. Number 6. Runny nose. We all experienced a runny nose, and we know that it is not a pleasant symptom at all. A runny nose can be caused by anything that irritates or inflames the nasal tissues. Infections, such as the common cold and influenza, are one of the main reasons that might cause you to have a runny nose. Another reasons are the allergies and various irritants, which are pretty common during springtime. Number 5. Tiredness. Feeling fatigued and tired can be a sign of the flu, often preceding other more identifiable symptoms. Tiredness can also linger after many other flu symptoms have disappeared, so you might have to struggle for a while. Sometimes the feeling of fatigue can for weeks after all other symptoms have cleared. This is because the immune system uses a lot of energy to be able to fight against the virus, meaning you may feel exhausted or lose strength in your muscles. Fatigue is a feeling of tiredness which is either extreme, either persistent, and sometimes both. The flu can cause you to feel tired and drained, particularly when your joints are aching, your nose is streaming, and you have a headache. I'll remind you again that these symptoms often appear at the start of the flu episode and may precede other symptoms. Number 4. Inability to arouse. Arousal is the physiological and psychological state of being awoken, or of sense organs stimulated to a point of perception. It involves activation of the ascending reticular activating system, areas in the brain, which mediates wakefulness, the autonomic nervous system, and the endocrine system, leading to increased heart rate and blood pressure and a condition of sensory alertness, mobility, and readiness to respond. When you feel that you might have lost your ability to arouse, this might be a sign that you have a virus in the body, and the immune system is concentrating all the resources to contain that virus, thus making it difficult to attain that state. Number 3. Bluish lips or face. Cyanosis is the bluish or purplish discoloration of the skin, or mucous membranes due to the tissues near the skin surface having low oxygen saturation. Cyanosis can also appear at any time later in life, and often accompanies conditions in which lung function is compromised, resulting in an inability to fully oxygenate the blood. One condition that causes bluish lips or face is the aspiration pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, purulent material, causing cough with phlegm or pus, fever, chills, and difficulty breathing. A variety of organisms, including bacteria, viruses and fungi, can cause pneumonia. Pneumonia can range in seriousness from mild to life-threatening. It is most serious for infants and young children, people older than age 65, and people with health problems, or weakened immune systems. So if you notice that your face, or lips slightly change their color towards blue, this might be a serious sign that your body does not get enough oxygen due to a viral infection in the lungs, and you should immediately contact a doctor to get professional treatment. Number 2. Persistent pain and pressure on the chest. Chest pain can be a sign of a heart attack or other cardiac condition, but it can also be a symptom of problems related to respiration. Most respiratory causes of chest pain are due to injuries to the lungs, or problems within the airways leading to, and coming from your lungs. Chest pain associated with a breathing disorder or other respiratory condition may feel like a heart attack or heart-related condition. The pain will likely increase with exertion and heavy breathing, and decrease with rest, and stable or slow breathing. In the case of infestation with coronavirus, that 20% of the people that are severely affected by COVID-19 are very likely to develop pneumonia. The chest pain with pneumonia usually starts as a sharp or stabbing pain that is worse when you inhale. If you have chest pain when inhaling, see a doctor soon. If you have chest pain and are coughing up blood, call your local emergency services. Number 1. Difficulty to breathe. Difficulty to breathe is one of the most advanced symptoms of COVID-19. If you are experiencing this symptom, it means that the disease is already in a very advanced state and you have developed pneumonia. If this is the case and you are experiencing also the symptom mentioned previously in the video, you must go to the nearest hospital because this disease cannot be cured with any known medication. And if your health state gets any worse, you might need to receive medical help to be able to breathe properly.